Welcome and thank you for joining us. Today's presenters are John Canosa, Director of Public Health for Clinton County, and Aaron Strife, Clinton County Health Department's Healthcare Services Director. Each of them has some prepared comments that they will provide, and then they will respond to questions from our viewers. We also have Mr. Eric Day here, the Director of the County Office of Emergency Services, on hand to assist with questions as needed. And as always, please just listen for your questions to be answered either within the prepared remarks or grouped with other questions at the end. We'll try to get the questions answered as expeditiously as possible. At this point, I would like to invite Mr. Canosa to the podium.
Thank you, Karen. Much appreciated. Good morning, Clinton County. It's Wednesday. Moving on forward here, I'll give you a report of our numbers for today. I'm proud to give them to you. We have 104 confirmed COVID positive cases in Clinton County to date. We had one new case yesterday on 6/2, no new cases today on 6/3, and also very important that I mention to all of you, we have no COVID positive cases presently at CVPH. That's a good piece of information to know. Of the 104 confirmed COVID cases, 98 of them are now recovered. Total tested people in Clinton County to date, 4,314. Numbers really getting up there. We extend our appreciation to the hospital for the significant testing they're doing every day. We also have 81 probable cases who have either tested indeterminate or are awaiting test results at this current time. And of those 81, 80 are now recovered. These numbers are a definite reflection, and I extend my appreciation to you, the public, for working so hard, as we all are, with our masks, social distancing, minimizing mass gatherings with a lot of people. You're doing all this. Your hard work is allowing us to have these great results. Yesterday, we had a meeting with our Clinton County, reopening Clinton County task force. Some of the items that were discussed, very solid. Gary Douglas reported that the North Country Chamber of Commerce has had great attendance at the various safe reopening trainings that they have been putting on over the last few weeks, and that will continue into the future as different phases come up for reopening. Dr. Davey from the Champlain Valley Educational Services mentioned that he recently sent a letter to the State Department of Health Commissioner, Dr. Zucker, requesting guidance from New York State regarding school graduation ceremonies. We're hopefully waiting for that. Also, Dr. Ignetti, SUNY president, discussed the safe reopening planning efforts that he and numerous staff from SUNY Plattsburgh have been working on to reevaluate opening come the fall of 2020 semester. So a lot of work is going into that, and they are identifying a lot of different scenarios, including more online classes versus in-class students, that is. So they're working really hard on that, and they have obligations to submit to the Chancellor of SUNY their plans for the upcoming semester. Resources for businesses in our communities. As of last week, highly detailed information is now available from the North Country Chamber of Commerce regarding Phase 2 businesses and their reopenings, including the templates that are available from their offices that can help you, your business, develop a safety plan for your organization. Businesses that need masks, hand sanitizer, can contact the United Way of the Adirondack region. Now, as we move closer and closer to everybody going back to work, there are some things to be planned, thought about. There will be new expectations. Safety plans for your workplaces will be prepared. Such safety plans may include more distancing between workers, possibly staggered shifts, possibly doing away with walk-ins. New policies and procedures will be prepared to offer worker safety, protection, such as requirements for wearing a mask while at work or a face covering, temperature checks, and wellness assessment. Also, new technologies will likely be more in use. Zoom meetings are the preferred way to have meetings these days. I've never done so many Zoom meetings in my life. I miss the old-fashioned ones, meeting in person. But that is what our future entails for us, at least for the short-term duration. When returning to work, some things your employer will need from you. First, understanding that the COVID-19 emergency has resulted in new requirements for management and staff at all workplaces. Flexibility to learn and adhere to safety provisions to better protect yourself, your coworkers, and patrons that visit your businesses. An honest assessment of your own health every day. You will be asked to provide an assessment how you're doing every day. Fever, cough, things of that nature. Again, it's very simple. If sick, stay home. Call your employer. Let them know. Also, it's important that I let you know state DOH testing criteria has been expanded again and now allows for testing of individuals employed by an essential business, food production, medical supply manufacturing, or any business that has been designated to reopen in certain regions of the state, phase 1, phase 2. First example that I think about is staff at hair salons and barbershops. Get in line for testing. You will need to do some testing. All providers that have close contact with their patrons will be looked at to having some sort of testing being done, whether it be in the beginning or continuing on into the near future. News a lot of you want to hear about, DMV and other county offices will be opening in the near future. According to recent information provided by the state of New York to us, it is understood that DMV offices could be open sometime as part of phase 3 reopening coming up in the next, I'll say, week and a half anyway, hopefully. We keep our fingers crossed, we keep good numbers, good metrics, we do well, we can move towards phase 3. Similarly, it is anticipated that county offices, other municipal offices, villages, towns may be able to open as part of phase 3 reopening coming up. And residents should expect changes for all municipal office reopenings. Case in example, scheduling your visits, when you get to the offices, maintaining social distancing, wear your face masks, face coverings. All of our county departments have been asked to submit safety plans for safe reopening. Some have completed those plans and others are currently working on those plans. Our Environmental Health and Safety Division staff has worked with our county's Director of Buildings and Grounds and also other county department heads to assess and make changes in several county office locations. First example that I can tell you right now is DMV offices have plexiglass installed for each of the counter spaces where patrons do business with DMV staff. Also, our WIC staff downstairs in our building, they have also had plexiglass installed to provide some barrier between the patrons that come visit us as well as our working staff. Most services in the future will require an appointment, as I previously mentioned, so be ready for that. Wait areas will likely be in your vehicle or outside, hopefully for only a short-term future time period. Again, your patience will be needed to try to offer the best service under difficult conditions that we're currently in. On the subject of school graduations, a hot topic these days because school graduations are coming up. First, I would ask all of the public to communicate with your school superintendent and or school board members to learn their plans for that specific school. Each school is looking at different options right now. As you can easily recognize and understand, we all need to think protection of our students, our kids, and our communities and families. Simply, we are just starting to see improvement again in our COVID numbers. Thanks again to you, the public, for working so hard. And we don't want to have any large gatherings that could result in a spike. One of the biggest concerns there is impact to our hospital. We do not. We guard, care for, and are on the lookout for burdening our hospital. We do not want to burden our hospital. They can only handle so many cases. CCHD staff, including myself, have been and will work with school administrators from different school districts to complete school graduation ceremony planning. I'm currently working on a couple of plans for 3 school districts right now. The best possible option currently for graduation ceremonies is a car parade. That's definitely the best way to go right now. That is most consistent with the governor's orders to not have large gatherings. In this example, the family and graduating student are protected, have some protection from COVID-19 by simply being in and remaining in their car, which provides a separation from other families and the school staff as well. According to the Champlain Valley Educational Services, guidance from the New York State may be provided to school districts, hopefully, again, I emphasize hopefully, in the upcoming weeks. And with that, I now turn the floor over to our Director of Healthcare Services, Aaron Strife. Thank you.
Thank you, John. My name is Erin Strife. I'm the Director of Healthcare Services for the Clinton County Health Department. We do have, as John mentioned, 3 active cases, and this is very encouraging. Even as testing increases, we're not seeing a corresponding increase in cases. So to us, that indicates that the rates of infection in our community are low. And again, as John mentioned, that's because we're doing an excellent job with the social distancing and the mask wearing and the hygiene measures, and that absolutely must continue as we move forward. So thank you for that. Contact tracing is going to continue even with these low numbers, and there may be more people who need to be placed on isolation and quarantine as we continue the reopening because more people can potentially be exposed. So that has yet to be determined, but we will continue to respond as needed to protect the community. The New York State contact tracing system is in place. At this point in time, we do not need those additional resources. If we were to get a spike in cases, we would have to reevaluate that and potentially call on their assistance. That, again, is yet to be determined depending on how things go through the remainder of the reopening phases and into the future. There has been a question about what happens if my employee tests positive. And while we're not asking businesses or employers to take on contact tracing for us, we definitely recommend that good records are kept in places of employment, and that includes not just what employees are working and when, but also, if feasible, who the customers are and when they are there. If that can be done reasonably by a business, that will go a long way to continuing to protect each other and ourselves. In terms of return to work, John did speak at length about this, but I do want to emphasize that self-care and safe hygiene practices are going to be very important. And self-care is not just physical care of our bodies, but it's maintaining that emotional awareness and remembering to reflect on how we're feeling and how we're interacting with others. Rochelle Gregory, our Director of Community Services, did a wonderful video on this and returning to work that is on our Clinton County social media page, and I would highly recommend that you take a look at that because that's going to be helpful information for us as we continue into the next few months. Any questions at this time?
One of the questions that we had just received was, when should masks be worn in public?
That's a good question. We would actually recommend that if you're going out in public to have a mask on. The technical need is if you're going to be within 6 feet of another person, but when you're in public, you can't always know for sure whether that's going to happen or not. There's not a guarantee that you're going to be able to consistently maintain that distance from others. So the best practice would just be to have your mask on at all times.
Thank you. There's another question that asks, what can I do if I have been asked to return to the office, but I don't feel safe there and feel anxious about returning?
That's an important question to have with your employer to discuss what systems and protections are in place at your workplace, and if you have specific concerns as you discuss those with your employer, talk to your employer about them ahead of time and work through them ahead of time so that you know what to expect and that you feel comfortable in that situation.
Thank you. There was a question, in what phase do we anticipate that fitness centers will be opening?
That's a good question. I actually am not able to comment on that, John. Phase 4, potentially phase 4.
Another question again regarding reopening. A couple of questions about when can we anticipate that larger gatherings such as funerals, wakes, weddings, things like that will be allowed to occur?
That's a good question too that I wish I had an answer to. My recommendation would be that we actually not plan on doing that until we have a vaccine or a treatment available. I would not feel comfortable recommending that, in August. Potentially we could resume that type of gathering. I think we need to remain cautious and vigilant for the foreseeable future.
Thank you. One of the questions that we received was in regard to protests in large groups with protests. A question as to why those are allowed but graduations are not.
I will say that in the case of protests, we at the health department have several very strong recommendations. First and foremost, that the 6-foot distancing is maintained, that masks are worn at all times, and even more important, that these protests remain peaceful, especially in our communities. We do not want to see safety of our public or the well-being of business owners being put at risk. It's everyone's right in this country to be able to protest, and it's important that we, under circumstances like this, do what we feel is right and promote justice and equity and compassion. However, please keep in mind that we are all interconnected, we are all one essentially, and we need to take care of each other and not harm each other under any circumstances.
Thank you. A couple of other questions, again, concerns regarding reopening and kind of the process of how that's happening. Some questions as far as why are day camps for children able to open while it's not safe for schools to open? And then the other question was, what about returning back to school? So I'm guessing when, potentially.
I'd like to speak to this. Thank you.
The governor, state of New York, just made a determination to allow day camps to resume. I believe it's either June 28th or 29th. There's part of day camps that provides for our public, those of you with kids, myself included, the opportunity for daycare. There's a daycare provision in that. So there is the opportunity for that daycare service to be provided as part of that, and they saw it as an essential service to open that. Please be advised, places that are having day camps like the YMCA, they are looking at significant safety planning for that to ensure that their patrons that they have for day camps are well cared for and protected from COVID. So the other part of that question, could you repeat that, Jen?
Apologize. Let me. What about returning back to school?
Back to school, I can tell you, because I am up front and center, working with all the schools, not just our public schools in our area, but also SUNY Plattsburgh, Clinton Community College, in the planning for opening schools come fall. A lot of work all of your representatives at our schools, our public schools, private schools, as well as SUNY Plattsburgh and Clinton Community College are working very diligently to come up with a plan. And as I understand, it's either this week or next week, they are due to provide those safety plans as well as their intentions to specific entities, whether it be State Education Department of New York or the Chancellor of the SUNY system, getting ready for that. So a lot of work is going into that. And they are calling upon me to provide whatever assistance I can provide to them. But the general plan for that is everything we're talking about here. Maximizing social distancing, cutting down the capacity of students in a classroom at one time, wearing masks, proper personal hygiene, all of these things will be central to that planning.
Thank you. The last question that we had right now was in regards to when the hospital will allow visitors. Do we have any information on that?
The hospital at this current time, I would advise you first answer would be contact your doctor, contact the hospital for that. The hospital has several different sectors, sections, parts of the hospital, for lack of a better word. Each of them is different. So I can't answer that specifically. I can just recommend to you, make the call to your doctor, to the hospital where you will be, or one of your family members needs to go into to get that specific information. So,
Great. Thank you, John.
Thank you for joining us today. We hope we've answered some of your questions, and please feel free to reach out to us if you have others. I did want to just clarify a point. There was a slight delay in getting the video from the Clinton County Mental Health and Services and Addiction Services video by Rochelle Gregory finalized and uploaded, so that will be on our social media platforms in the next day or so. So if you're looking for that, just hold tight a little bit and we will get that up. It's very good information that she has provided for anybody who may be headed back to work or just having some concerns at this point about their own health and safety. Thank you.